I'm Dr. Jameel Smith, lead pediatric psychologist and clinical assistant professor at Wayne State University School of Medicine. I'm so excited to welcome one of our esteemed general pediatricians, Susan Harris, here at Wayne Pediatrics. Welcome to this episode of Detroit Peds Talk. It's almost time to send our kids back to school, which means your family needs to make sure that their vaccines are up to date. And to help us better understand this topic, my guest today is Dr. Harris, who's going to give us some information about vaccines and maybe answer some questions that parents out there may be having. Thank you so much, Dr. Harris, for joining us.
Hello, thank you for having me, Dr. Smith, and hello, everyone.
So why don't we start with you helping us understand, Dr. Harris, how do vaccines work, right? Like why do we even need vaccines?
So vaccines teach our bodies how to fight off diseases caused by germs such as viruses and bacteria. First, we put the vaccine in the body, and that's either a medicine by mouth or a shot. And the vaccine is a weakened form of the germ or a small dead part of the virus or bacteria, or it could be instructions on how to fight off the disease. The vaccine does not make your child sick with the disease. It just gives the body's defense system or immune system the information on how to fight off the disease with antibodies. Antibodies are special proteins that the immune system makes, so that next time your child is exposed to these germs, the body already knows how to fight off the germs with the antibodies and keeps your child from getting very sick. I do want to say that some children cannot get certain vaccines, especially what we call live vaccines, because their immune system may be compromised from medicines or from disease. And some young children are not eligible yet for certain vaccines. So it is very important that those of us who can get all our vaccines on time do so that we can protect the others. And this is called herd immunity. So by having most of the people vaccinated, it will help protect those children who cannot get these certain vaccines.
Yeah, I think you raise an important point. Vaccines aren't just helpful for the individual child, but it certainly helps the community as we try to fight off certain illnesses and diseases and things of that sort. So that's helpful to know. What are some common diseases children are vaccinated for?
Well, according to Michigan law, children must have 2 combination vaccines to attend school. They are called DTaP, or diphtheria, tetanus, and acellular pertussis, which is whooping cough, and MMR, or measles, mumps, and rubella. They also require vaccines against polio, hepatitis B, chickenpox, and for older children, the meningitis shot. So the combination vaccines, such as the MMR and DTaP, are better because they have the 3-in-1, and they can protect their children from several diseases at once in one shot. So this is less painful, it's easier for the parent and the child, and it's lower cost. Yes, and there are also other vaccines that children should get before going to school, so please discuss that with your doctor.
Yeah, we talked a little bit about how vaccines aren't just helpful for the individual child. Why are vaccinations even important?
Well, because diseases spread among people, especially when they're in big groups, such as in school. And kids often put their hands in their mouths, even though we tell them not to, so that can spread germs. And they also spend a lot of time outside, so they can get more germs from the dirt and the environment. And also their immune systems or disease fighting abilities are less developed, so they need more protection. So one way is by giving them vaccines. Vaccination has been a hot topic, but for over 200 years, vaccines have been found to be safe, effective, and a low-cost way to prevent illness, and has saved millions of lives.
Absolutely. We know that many families have been hesitant around vaccines. We've seen that with COVID and a lot of the misinformation around the COVID vaccine. We've seen this decrease in overall vaccinations. So, what are some of the things parents can be thinking about as they make these decisions and helping kids cope with the vaccines that they might be getting?
Well, first of all, please consult your child's doctor to help you decide which vaccines are right for your child, and trust reputable sources such as the Center for Disease Control or the American Academy of Pediatrics, which has excellent information. Uh, Children do cry after they get a shot usually, and that is okay and that is normal. So as a parent, yes, you will expect that your child may cry, but just console your child after and tell them that it's going to be okay. Also, even if you as a parent are afraid of vaccines, don't show that on your face to your child if possible. Put on a brave face for them and they will read your cues and be braver for the vaccine. Afterwards, hug them, give them a treat if you want, and they will be better off for it. If your child gets some pain or fever after the vaccine, your child's doctor can give you some advice on how to deal with that as well.
Yes. Well, thank you, Dr. Harris, so much for this important information, teaching us about how vaccines work, how they protect our children, and why they're important. To book an appointment with Dr. Harris or our other Wayne Pediatrics team members and physicians, visit our website at waynepediatrics.org. Remember to follow us on social media for the latest news. And remember, pediatricians are the best option for the medical care and needs of children. Take care.
Thank you.